Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you are just joining us, we are talking about leukemia, a cancer of the blood cells. It starts in the bone marrow, as we mentioned earlier, and we do have some viewer questions for you, Doc, so let's get to those. Joe from Manilo asks, is it possible to have leukemia and not know it? We talked about that earlier.
It is possible, especially the chronic kind, and that's something that would end up getting diagnosed on a random blood test. But again, if you don't know it, then it's probably not that serious, or at least not that deadly. The type of leukemias that are serious and deadly, you know it because you got fever and night sweats and weight loss and infections and weakness, tremendous fatigue, swollen lymph nodes, a lot of symptoms.
You're going to know it. You're going to know something's wrong. Okay. Brittany from Jigo asks, is leukemia hereditary?
Yes, it can run in families a little bit, and of course there's the environmental aspect too of toxins in the environment.
Okay. Melanie from Tumon asks, can leukemia cause my other organs to swell? Is there any way I can prevent that from happening?
Probably not any way you can prevent it. It is something that doctors do look for, though. So we mentioned that leukemia is basically a liquid cancer. It's a blood cancer, and those white blood cells can settle in the lymph nodes and also in the spleen and also even in the liver or brain or actually the eye. Many children actually will present with leukemia behind the eye or as infiltrating the eye and have a solid tumor that way. So it's something that we look for. There's really no way to prevent it, but if it's happening, then it can be treated with chemo.
So, for instance, in the instances of the eye, I mean, is there a way to correct that?
Well, they would get radiation and chemo and you know, go from there. Each case with leukemia, again, is one of those very individual cancers where case by case, and they do genetic studies to find out what is the exact cell that's, you know, reproducing here abnormally, and was very targeted therapy for it.
Okay. Our next question comes from Vicky from Agate. She asks, is there a connection between smoking and leukemia?
Yes, there is. Smoking in all cancers, but when you smoke, you're inhaling a chemical called benzene. That also comes from car exhausts. So people that sit in traffic for ages and ages, or secondhand smoke also. So when you inhale that benzene compound, that can be toxic to your cells and the cells of your blood and contribute to leukemia.
Okay. Yeah. Carlos from Tamuning asks, I have swollen lymph nodes. Should I be concerned about having leukemia?
Well, probably not. Many of us have swollen lymph nodes when we have a sore throat or a cold or, let's say, mono. The lymph nodes will get really huge and scary size, but most of the time they have a rubbery feel. They wiggle around in your neck, let's say, or even in the groin area or under the arms. You can have little tiny lymph nodes. They'll swell and be kind of rubbery and wiggle around and sometimes be a little tender. But with leukemia or lymphoma, if you'll just get a giant swollen lymph node, it'll be like a rock. It doesn't really wiggle or move very well, and it's not painful. It's just like a stone.
Just there.
Yeah, and so that gets biopsied. The doctor will take a little needle and stick it right into the lymph node and put it on a slide and look at it under the microscope and tell you whether that's anything to worry about. So to answer the question, if you have a lymph node that's getting bigger, and especially if you have any of the other symptoms we talked about, like fever or weight loss or feeling tired, then you can get the biopsy done.
Okay, I know this might be a silly question, but what are lymph nodes' purpose?
What's their purpose? It's a great question. So the way I think about lymph nodes is like little barracks of soldiers scattered all around your body. So they're like a little port where if there's an infection, that's where the soldiers will come out of to fight in the area. So let's say you have a sore throat. The soldiers in this area will be activated, the barracks will swell, everybody goes out, fights the war. When the war's over, they go back in and relax. So your lymph node is like a little center of activity for your white blood cells that can fight infections or inflammation.
Good way of describing it. Okay, yeah. And our last question comes from Vanessa from Dededo. She asks, what is radiation therapy? Will I lose my hair?
Yeah. Radiation is, you know, a beam of ionizing, basically energy that's used to destroy cells. And this is a lot different than x-rays, but it's kind of a similar principle where you're shooting energy to destroy cells. And depending on where they're putting that energy, you could lose the hair. If they're doing radiation on your head, you definitely will lose the hair. But if they're doing radiation on your leg, your hair will probably be just fine. But the chemo, definitely, the kids lose their hair, and adults often too.
Okay, any last words that you'd like to leave with our viewers about leukemia?
Well, you know, there's a lot of hope. I know Dr. Shea's worked hard here on Guam to get people registered for the bone marrow drive and so on. And you know, bone marrow transplant and stem cell transplant is there now to help people, you know, basically you kill their bone marrow and put in somebody's healthy bone marrow, and they can survive. So if you're able to, you should sign up next time there's a drive and participate in the bone marrow drive on Guam.
All right, thanks, Doc, again for coming in. And of course, you'll be back again next week, and we will be talking about something that you don't often hear about, but leprosy. Send us your questions to healthyliving@kuam.com. Stay tuned as we take you to a local OBGYN's clinic to see the latest amazing technology to see your precious baby before they make their grand entrance into the world. Stay with us.